you surely can't ultrasound every patient, so what are the indications which would make you want to do this? So abdominal tenderness on the same side as back pain?
Absolutely. So we talked about the first clue, and that's abdominal tenderness. And going back to the palpation there, one thing that I think is quite helpful is when you're examining your patient's pelvis, and I'm sure all of our audience do this. We've got our patient standing in front of us, we're seated, we're palpating the sacroiliac joints, doing the Gillet tests and so on, asking if it's tender. Let your fingers come up round the waist a little bit and just give a little bit of prod in with your fingertips and see if both sides are equally sensitive. And one of the things that I always think is quite funny is that female patients, if there is tenderness around the flank, just say it's the right flank, and I'm sticking my right fingers in there, they'll say, "Oh, that's a bit uncomfortable." The left side feels normal, and to me that's the start of my abdominal palpation. I've come at it from the back, but it's just quite a good way to introduce it to your routine. Male patients, when I do that, they'll tell me that's ticklish, and they won't admit that it's tender because they're blokes. But I always think it's quite funny because the right side of your waist is ticklish and the left side isn't. I go, okay, that's fine. And then we go on to the other tests. When they're supine, I'll then palpate their abdomen, and then we establish that they are indeed tender on the right side of the abdomen. But the other clue, the second clue for our audience, and we'll see it on the slide here when it comes up in just a second, is I think that on every patient that has back pain, I think we should do a urine test. They're really easy to do, they're cheap, and again, we don't charge patients for doing a urine test. I think we should always do it. And if there's some microscopic hematuria, that should give us a clue that there might be some sort of pathology, either a gynae pathology on a female patient, or a urinary tract pathology or prostate pathology in male patients.